Good morning, friends. Welcome to our next learning session. And today I am going to tell you about the silent ischemia, that is the changes in resting ECG. As I told you before also, that about 40% of patients with proved heart disease, they have changes in their resting ECG. 60% will pass off if you only depend upon resting ECG. I also told you that 8% of the patients who do exercise ECG only, they show changes only during the period of exercises, and as the exercise finishes, the changes also disappear. There are few patients who continue to show changes beyond 5 minutes after finishing the exercise. So these are some of the variations, but today I am going to show you certain ECG which will make you clear about the changes in the resting ECG. Now see this diagram. This is the ECG with resting ECG showing changes in the ECG. See what are the changes. See in this ECG, in all leads there are changes in the ST segment, and somewhere there is Q wave also. Here, like this patient, there are Q waves, and these type of changes in resting ECG occur only in 40% of patients. The rest will pass off as normal persons. Now, to make it more clear, I show you how a normal ECG will look like. See, this is the lead 1, 2, 3. AVR, AVL, and then AVF. And go to this side. This is lead V1, V2, V3, V4, V5, and V6. The important things to note are, look at this. This is a small wave, this is the P wave, this is Q, R, S, and then this is a big V wave called T wave. This is the lead 2 is the best lead to see these complexes, and that is why I am pointing out here. But these same things are present in other leads also. So this is the resting ECG. You will note that the ST segment, that is this segment, ST segment, is at the same level as this baseline. You see, this is the ST segment. This is at the same level at the baseline, and therefore this is a normal ST segment. See this also shape also, it goes slightly up to merge with the T wave. S wave coming down here, and then it starts rising up and makes the T wave. To make it more clear, I show you another ECG, ECG part of ECG, I should say. See, this is, what is this? This he is trying to show J point. J point is the point on ECG where S wave joins the ST segment. This line, this is showing the ST segment. Okay, I make it more clear. See, this is the ST segment, and this is the S wave. The wave which is coming down, S wave. Again, I will make it more clear. This is the Q wave, this is R wave, this is coming down is the S wave, and then this is the ST segment, this is the T wave. So the junction of S wave with ST segment is called J point. Here also it is shown and here also is showing. But you note another thing here, that this line is the baseline and this ST segment is much above the baseline. So this is the abnormal thing. Here in the same thing is shown in this ECG, that this is the J point, this is the ST segment, and this is the S wave. Here the ST segment is much below the baseline. Here the S segment was much above the baseline. See another one, another graph. Here I have marked actually with this is the level of the baseline. This is the level of the baseline which I have marked here. This is the level of baseline, and you do note that this is much about 3 millimeter below the baseline. This is also showing 3 millimeter below the baseline. This is also showing the same thing, and this is also showing the same thing. What is important is that what is the shape of ST segment. You see, it comes down, it goes up, it again goes down before it merges with this thing. So it is going up, down, and again up. And here also it is slightly going down, it is going down and then going up and then a little down. Now here in this ECG, what you are finding, that ST segment is going down. It is called down sloping ST segment. This is also abnormal. A down sloping ST segment is also abnormal. To make it more clear, look at this diagram. This is ECG complex shown. This is the P wave. This is this is QRS segment. This is J point, and this is the T wave which is going up. So ST segment is gone. This portion is showing the ST segment. This is the division, and this is the baseline. See, this level is the baseline, and it is at least 6 millimeter above the baseline. See this is 5 is this, and one more 6 millimeter above the baseline. This is grossly abnormal ST segment. And now look at the first diagram again. You see, this is the ST segment which is going down and then merging with the T wave. See, this is the ST segment. This is the ST segment, and it is going it is down sloping ST segment. This is the definite abnormal ST segment. So friends, the ECG, resting ECG, can be sometimes deceptive, but if you find changes in the resting ECG, then it is definitely abnormal. Changes in in the resting ECG can be in the presence of Q wave, the deviation of ST segment above or below the baseline, T wave inversions. Sometimes in a normal resting ECG, T wave is inverted. This can be normal, like for example in V1 lead, T wave may be inverted, it may be upright, and it may be biphasic. Any of these findings can happen in lead V1, in V2 also to some extent, V3 occasionally, but V4, V5 and 6 always show T wave upright. Similarly, in other leads, T wave is usually upright, except in AVR where it is an inverted T wave, normally inverted T wave. So you have to see, in fact this requires a lot of practice, seeing the ECG, recognizing P wave, recognizing QRS complex, recognizing the T wave, and then looking at the segments. ST segment, very important to tell you about ischemia. The duration of QRS complex, where it is less than 0.12 seconds, that is the 3 small square. It has to be less than 0.3 3 small square, that is 0. Normal is 2.5 small square, that is 0.1 is normal. Upper limit is said to be 0.11 seconds. So if it is more than that, then it shows some sort of intraventricular conduction defect. That is defect in the wall, the impulse which is traveling in the wall of the heart, that is being hampered. So friends, these are the important findings. I thought I will, while reminding my, see, I had received a case from Muzaffarnagar, who was 60 years male. He was the elder brother of a doctor who was in general practice. The case was brought to me and he had changes in the resting ECG. Of course, he was diabetic also. Therefore, I told them that this is a severe disease. I put him on anti-angiogenic drugs, which kept him alive for some time. But I think it was after 2 or 3 years that the patient died. Because at that time the stenting and ballooning and bypass was not available here in our country, and therefore we had to depend totally on the medicines. So friends, thank you very much for listening this thing. Most of the medical things are learnt by practice, but I am telling you again and again so that you can become aware of these things. Slowly and slowly it will also have impression on your mind and you will also start understanding. But first time, I agree with you, it will look little difficult and odd. Some people may be totally disinterested, but those who have slightest inclination towards the medical science, they will again, when listen again and again, will start remembering these things. Thank you very much. See you next time with another case.